Hey everybody, so there's sometimes some confusion around the difference between two types of treatments that I do, and in part because both of them are injections and both of them use dextrose. And so I wanted to take a second here to talk about the difference between perineural injection therapy, which uses a low concentration dextrose, and prolotherapy, which is going to use a higher concentration dextrose. So, as I already said, both of these are injections, and so we're using needles to basically place the dextrose in particular areas to try and have a certain effect on the tissues that we're injecting. And so, first, let's look at perineural injection therapy. So, perineural injection therapy, the ultimate goal is basically to get neurogenic inflammation or nerve inflammation to calm down. Now, there are different substances that can be used, but I'm mainly just going to talk about the kind of our baseline substance, which is a 5% dextrose solution that we buffer so that it has a neutral pH. And the current, it's not 100% understood exactly how this works, but kind of the current research is showing us that basically this 5% dextrose has an impact on potassium outflow from a particular potassium ion channel called the TREC ion channel, which result in alterations and changes in the TRPV1 ion channel. Now, the TRPV1 ion channel is the ion channel that basically secretes substance P. Now, when substance P is secreted into tissues, our brain will perceive this as pain. And so by decreasing the amount of substance P that is released from these TRPV1 ion channels, we can actually decrease the perception of pain in the brain and help patients kind of resolve their pain through that mechanism. Now, generally these are subcutaneous injections, so we're using like a 1/2-inch needle. In some instances, I might use a little bit of a longer needle, a 1 to 1.5-inch needle, if I'm trying to get a nerve that is piercing through a deeper layer of fascia that's a little bit deeper. But usually this is all going to be palpation guided, just because a lot of these nerves that we're treating are actually insanely difficult to see under ultrasound guidance because they're so small. And so because of that, we use palpation techniques and we cover a little bit of a wider area with our injections.